Devastated by decades of conflict, Afghanistan is one of the countries with the most inefficient healthcare system, and for decades the healthcare system has been almost entirely dependent on international aid. The only known private systems are hospitals inside military bases intended only for resolute support personnel.
Doctors Without Borders or Medicine Sans Frontières is a medical, humanitarian, and action organization that has been working for many years in the country and seeks to ensure free treatment in all circumstances. However, after the establishment of the Taliban regime in 2021, international donors decided to suspend the funding on which healthcare depended, so that many health centers closed and those that remained often barely functioned. Lacking sufficient staff, equipment, and medical supplies, the organization finds it difficult to fulfill all the needs of the Afghan population.
MSF has been responsible for implementing the following programs and infrastructure in the 7 care points spread throughout the Afghan region: maternal, pediatric, and surgical care, trauma center which has 54 inpatient beds, a 6-bed ECU, 2 operating rooms, and an outpatient department, a clinic for displaced persons with general pediatric consultations, including vaccinations and nutritional care, National Tuberculosis Treatment Program, and a specialized hospital for maternal and neonatal care. The hospital has 60 beds, a neonatal unit with another 28 beds, and 2 operating rooms.
In terms of administration, there is currently an interim agreement in place. Since money cannot be given directly to the Taliban government because it does not have international recognition, humanitarian agencies finance the salaries of medical personnel and the cost of medicines and food to keep hospitals running.
In the last 20 months, the hospitals have collapsed due to the number of patients, especially children with curable diseases that cannot be treated due to the lack of supplies and personnel, and therefore the mortality rate is very high. To give an example, in a room with 60 patients, only 2 nurses are in charge.
The Humanitarian Response Plan for Afghanistan 2023 shows an increase in the number of people in urgent need of humanitarian assistance. However, despite some efforts without sufficient funding, 8 million people in Afghanistan will lose access to potentially life-saving essential healthcare. Since the government does not act directly with the health, the plans are to wait for the daily appeal to the UN and other international organizations to finance the country's sanitation.